So infection control management, standards, reports, challenges, and solutions. So infection prevention and control teams or policymakers or the members of hospital infection control committee. Okay, they are not the only person who are solely responsible for infection control and prevention. Anyone who is working in the healthcare industry, okay, who is in contact with the patients or with other healthcare staff, they are also supposed to be aware of the infection prevention and control core components. Okay, they should awareness and responsibility is the duty of all, not just the people who are in the infection control team, infection control nurses, microbiologists. Okay, this is not only the responsibility of those, but also for all the healthcare workers. So core components, there are about 8 core components we'll discuss. So first core component is the infection prevention and control programs. Okay, so hospitals should have one full-time trained IPC, focal point or nurse or a doctor who is full-time in infection prevention control. Don't hand her or him other job responsibilities. Their sole job is to check the prevention and control strategies throughout the hospital. Okay, for every 250 bedded hospital, one full-time trained IPC is required. Okay. Hospital administration should support the IPC program with dedicated budget, a multidisciplinary committee, and access to microbiology laboratory should also be available. Okay, so every year annually, when you are doing the budgeting, a specific amount of the budget should be dedicated for infection control programs. Okay, it should be a multidisciplinary committee that we have discussed earlier even in previous class when we have discussed about hospital infection control committee in detail. We have discussed heads of the departments, of which all departments, not just the clinical but also the non-clinical heads of the department should also be the part of this multidisciplinary committee. Okay, and the microbiology laboratory access should be available wherever IPC team is present. Core component 2, incorporate evidence-based guidelines for IPC. Along with that, educate, train, and monitor the adherence level of healthcare workers with the guidelines outlined. Okay, first you have to make sure the guidelines that you put in practice is evidence-based. Okay, check the CDC website, you will get the evidence-based guidelines. Speculated guidelines are also available, which does not have enough evidence, but it is supposed to help with infection prevention. Okay, so those guidelines are also available on CDC website. Check that. Monitor the adherence level. Is your healthcare workers, are your healthcare workers following these guidelines or not? That you have to check. Just by implementing guidelines is not done. Okay, you have to check if everyone is following this or not. Follow evidence-based standard operating procedures, especially for these areas: hand hygiene, decontamination or reprocessing, environmental cleaning, biomedical waste management, needle stick injury, injection safety, occupational health, aseptic techniques for all invasive or non-invasive procedures, triaging infectious patients, standard and transmission-based precautions. For all these topics, evidence-based standard operating procedures, which are universal, should be employed. So core component 3, the recorded session will be uploaded on the YouTube channel. You can check it later in the ICM infection control playlist. So the core component, infection prevention, control, and education and training is the third core component. So here you have to train people, you have to give them learning, teach people, conduct training sections, seminars, webinars, okay, conferences, okay, these has to be undertaken. So make sure all the healthcare workers are participating in some or the other way in infection prevention and control training, and especially for all the frontline clinical staff and cleaners as soon as they are hired. Okay, don't send untrained cleaners or housekeeping staff into a clinical area. You have to train them properly, and then they will be sent to areas to work. Undertake team-based and task-based trainings such as bedside and simulation trainings. So these are conducted annually at every hospital. Core component 4, hospital or healthcare associated infection surveillance. So surveillance means to look out for. What do you look out for? Signs and symptoms. Okay, every infection, every healthcare associated infection initially shows some signs and symptoms. If you are aware, if you are alert, you will not miss it. So that is surveillance, keeping an eye out for. And if you have caught any healthcare associated infection, you report it, you note it down, you report it to the committee. Okay, and do research and analyze that each and every incident. How did it happen? Okay, so surveillance is necessary to direct the infection prevention control interventions and for early detection of outbreaks. Okay, even to check any outbreak, to keep an eye out for outbreaks. Outbreaks means what? Two or more infections which people who have similar kind of infections, two or more cases coming up together at the very same time, that could be an indication of an outbreak. Okay, which in turn will allow for timely feedback of results to healthcare workers. When you keep an eye out, you analyze, you report, and you send back the communication to the healthcare workers, they will be accountable for their actions and they will get involved in the control strategies. Okay, so functional healthcare associated infection surveillance should be carried out through laboratory reports. Laboratory reports should justify the healthcare associated infection. It should prove it. Okay, medical records should state it. Okay, trained staff should be utilized. Skilled and trained staff should be utilized to take care of these conditions. Antimicrobial resistance records should be maintained. Okay. Core component 5, multimodal strategies. So hospital administration and healthcare workers should coordinate and facilitate the implementation of IPC activities through multimodal strategies. Strategies are carried out at healthcare settings, which involves improvement intervention, whatever, in whichever way you can improve. Okay, even though you know that you are practicing all the evidence-based strategies, but how can you improve better? How can you do better? Okay, for these topics, always a room for improvement should be kept open. Okay, so hand hygiene, safe injection practices, decontamination or reprocessing of medical equipments, instruments, devices, cleaning environment, sterilization, disinfection, standard and transmission-based precautions, triaging the patients, reduction of specific infection in high-risk areas of hospital. So in these areas, always look out for strategies which will improve your current scenario more and more. Core component 6, monitoring and auditing the feedback. So monitoring and auditing should be carried out to assess the level of adherence of healthcare workers. So just by having these guidelines, just by having these strategies, everything is documented, everything is written down, printed out, it is stuck on the walls, will not help. Okay, you have to actually see. Somebody should be accountable to see and identify, is your healthcare staff, okay, they are following these guidelines or not, they are taking out these strategies or not. Okay, is it just for others to see, watch, read and go, or is it for them to understand, comprehend and put into practice? Okay, so feedback of these results, monitoring and auditing should not be kept to yourself. When you are monitoring someone, when you're observing your staffs, how they are working, okay, and you have some conclusions, you will not keep it to yourself. You have to correct them. You have to rectify to them. You have to give the feedback back to them. This is what I found out of your work. You have to improve in these many areas. Majority of our staff has to improve in these many areas. There is a conclusion. It has to be communicated back to them. They should be aware where they are doing things wrong. Okay. Core component 7, workload, staffing, and bed occupancy. According to the recommendations, bed occupancy should not exceed the standard capacity of the healthcare facility. If you are a 250 bedded hospital, you cannot admit 251 patients. Okay, the patients you admit should be equal to or below 250. Do not overcrowd your hospital. Okay. Do not exceed the standard capacity of your healthcare facility. The healthcare worker staffing levels also should be adequate. For example, when you're hiring people, when you know your hospital is a 250 bedded hospital, there will be a list of nurses. These many number of nurses you should hire. Okay, for a 250 bedded hospital, at least you will require 50 to 60 nurses. Okay, so that much nurses should be there. You should have the budget to uh, pay these many give salary to these many nurses on a regular basis. Okay, so your hiring system should be adequate. Okay, you should not be understaffed or overstaffed. So with the help of this, you can adequately work with the patient workload, reduce the risk of healthcare associated infections and antimicrobial resistance. AMR means antimicrobial resistance. HWC is healthcare worker. HAI is hospital acquired infections. So spacing of at least 1 meter should be maintained between two patient beds. Okay, there should be a space of at least 1 meter between two patient beds. And the overall occupancy, how much people are admitted in your hospital, should never exceed your total bed capacity. If it is a 500 bedded hospital, the bed capacity should remain below 500. How many people have occupied your bed? It should be below 500, not more than 500. Core component 8, build environment, materials and equipment for infection prevention control. Hospital environment should be clean and hygienic, along with the availability of appropriate IPC materials, equipment and facilities, healthcare activities. Okay, for example, when you're building a hospital, you should make sure you have provisions for safe water supply to your patients and staff. Okay, you should make provisions of separate toilets, male and female toilets for both patients, staff, and visitors. You should spend money on coding your waste bins. Color coded bins has to be put into place, especially at all clinical wards, clinical facilities. Okay, provision for isolation facility should be there. At least 1% of the ICU beds should be, how many ICU beds you have, 1% of it should be isolation beds. Personal protective equipment supplies, you should not run out of personal protective equipment at all. Okay, so this is the money that you spent on the resources, materials, building a proper physical structure to carry out infection control practices. That is the 8th component. Coming to the ICM standards, leadership support, which should be visible and tangible. Okay, leadership, whoever is the hospital leader, okay, administrator, director, okay, CEO, whoever is the hospital's leader, should be visibly and tangibly supporting the ICM standards. Okay, at every level of the healthcare facility. They should not be someone who is completely invisible from the infection control and prevention strategy. They should be a part of it. Everyone should know, healthcare workers should know that our leader, the head of the department, and the top manager, okay, whoever is the owner of the hospital, they are also involved in these strategies. So only then your hospital healthcare workers can take infection prevention and control strategies seriously. Okay. Education and training of healthcare personnel on infection prevention control guidelines to meet the needs of diversity in workforce and the type of facility. Making sure that when you are educating or training your healthcare workers, they would know how to meet the need of different categories of people. Okay, universal precautions where they have to use, standard precautions where you have to use. When you are exposed to a diverse kind of population, how to deal with it. Okay, in terms of age, gender, race, ethnicity. Okay, to promote diversity in workforce. Okay, education and training of healthcare personnel is important. Appropriate infection prevention education and to patients as well as patients caregiver is important. Even the caregivers of patients should know what is the impact of how good is the infection control prevention strategy, how it will impact the patient's health even after discharging the patient when they go back, how they can practice infection prevention strategies at home. Okay. And also teach the caregivers or visitors. To teach the evaluation for signs and symptoms and notification, to teach the caregivers what kind of signs and symptoms they have to look out for after discharge. If there is still a rise in temperature in the patient, bring them back to the hospital. After discharge, the patient is complaining of pain in certain areas and there is rise in temperature, immediately bring the patients back to the hospital. Okay, so these signs and symptoms, how to evaluate them, how to notify the healthcare worker. Caregiver should also know, okay, how to deal with it. Even when the nurse is at rest, doctor is at rest, patient is only with the caregiver. Okay, how will they take care of it? Performance and monitoring and feedback on adherence of healthcare workers towards IPC practices and requirements. Always do performance appraisal, monitor the performance, and after monitoring, good or bad, feedback has to be given back to your healthcare workers. All the nurses, physiotherapists, doctors, everyone should receive the feedback. Okay, where they have to improve, which are the areas they are constantly forgetting. Okay, keep them training on that. Use standard precautions. Universal standard precautions has to be used everywhere, irrespective of what the case you are treating. Okay, hand hygiene, environmental cleaning, disinfection, reprocessing of equipments, injection and medication safety, using personal protective equipment, respiratory hygiene, cough etiquette, okay, reprocessing principles. Here, all standard precautions has to be used, whichever healthcare facility you take, in whichever part of the world you take. Okay, standard precautions will be used in these areas. Implementation of transmission-based precautions for suspected patients with transmissible infections. How can you identify suspected patients? When they're standing in line in the waiting area, they will have a lot of cough, they will be feverish, they will look tired. Okay, they're sneezing a lot. Okay, so in these conditions, you will understand, okay, these patients may be carrying something transmissible. Okay, so examples are diarrhea, meningitis, fever and rash, respiratory infection. So when you see these kind of symptoms in your patients, immediately isolate them. Okay, do a complete checkup, wait for the laboratory results. When the laboratory results are back, then you can decide, so should the isolation be followed up, or you can stop the isolation. Early and prompt removal of invasive devices. As soon as it is prescribed by the doctor that no more catheter is required, no more central line is required, patient can be out of ventilator. As soon as you get the information, immediately take them out of the invasive devices. Occupational health and safety through immunization, post-exposure prophylaxis, blood-borne pathogen standards, PPE standard, respiratory protection, TB compliance. Okay, there is more to it. Okay, just the famous few I have mentioned here. Okay, so you can follow the OSHA guidelines as well. Oh, sorry, OSHA guidelines of occupational safety and health administration. That is OSHA. You can follow their guidelines as well for more information. Failure of medical staff to comply with the IPC recommendation has to be monitored. It has to be, whenever you find out a failure, it has to be rectified immediately. Do not hold back the information. Patient-related barriers to infection control, like if the patient wants to discontinue treatment, patient does not want to continue treatment, patient does not have enough economic condition to continue the treatment, or the patient is not aware of the infection prevention and control strategies. Sometimes they will not cooperate. Patients and the caretakers both will not cooperate. Okay, so these are the failures. These are the challenges. It is very important, a very difficult situation for the medical staff. High workload for nurses and laboratory staffs. Okay. All over the world, we face this. We do not have enough number of doctors and nurses to take care of the growing medical demands of the population. Okay. We are understaffed even in the laboratories. Okay. And even the number of staff that we have already, they are not motivated enough to control, to follow the infection control guidelines. So this is another challenge. Okay. First of all, we don't have enough staff, and the staffs that we have, they lack knowledge, or they're not motivated to learn more. The lack of knowledge of IPC guidelines among healthcare workers and inadequacy of educational and training programs, sometimes in college level, okay, and even in fresher, when they are freshers, when they are working as fresher staffs in the hospitals, they are not given enough and good quality training or education, especially about infection control and prevention. So that is a challenge. Lack of nurses, laboratory staffs, infection control specialists worldwide. Okay, in India, it is definitely there. This lack of staff is there, medical staff. Lack of IPC equipments and materials, not producing enough infection control prevention equipment and materials. And if production is low, distribution will also be low. Passive surveillance system. Even if you see some signs and symptoms of hospital-acquired infection, some nurses or doctors may let it go. They think that it is a side effect of a medication, or it is a side effect of the complication they are undergoing, and they will not take progressive action. Okay, they will not take immediate action to rectify this. So that is passive surveillance system. You are noticing the signs and symptoms, but you don't care to report it, or you don't care to act on it. Okay, under reporting. You know exactly a case got complicated because of hospital acquired infection, but you don't want to report it. Okay, because it can be challenging for you later on. So these are the issues. Inadequate monitoring system. You don't have enough staff, or you do not have trained staff to monitor the signs and symptoms. And lack of feedback. Even though you're reporting, nobody is there to give you a feedback. Okay, reports are going to the hospital infection control committee, but there is no response from them. Okay. Then validity of innovative technologies. A lot of technologies are coming up in recent years, but are they valid? Can they do the job they are meant to do for? Okay, so validity of some technologies are still a question mark. Antimicrobial resistance, that's a big thing now. Okay, antimicrobial resistance, earlier it was antibiotic resistance, but now not just the antibiotics, but even the antivirals, antifungals, okay, they all are showing resistance. Even the bacteria, viruses, fungi, they are also getting their versions are changing. Okay, they are also evolving. So it is creating an antimicrobial resistance now. Solutions. Electronic media. So for all these challenges, what can we do? There should be some solutions. Okay, so electronic media and satellite communication for evidence-based researches. Now, if you want to find a checklist, infection control and prevention checklist, Google it. Just type infection prevention control checklist. You will get so many articles from CDC. Okay, CORTI checklist, CLAPSI checklist, WAP checklist. Based on every topic, just put a CDC XYZ topic, checklist, or guidelines. Google it. Okay, use your internet browser. You will get the answer. Okay, you will get so many journals also, evidence-based answers you will get. Capacity building through structured curriculum in medical and nursing education. Okay, capacity building means you are not paying them salaries. Okay, but still you have skills. Okay, this is the unpaid skills. You have to tap into it. These are the medical and nursing students. Okay, you can build your capacity. Any country can build their healthcare capacity by tapping into the potential of their medical and nursing students during their education. And even freshers, staffs who are freshers during their on-job training. When you strengthen their curriculum at these phases, it becomes the job becomes very easier later on. Okay, through workshops, seminars, conferences, CMEs. Okay, Use of infection control assessment tool. ICAT is an infection control assessment tool. You can Google it. Infection control assessment tool. Google it. You will get the checklist about it. Download it. You can use it in your hospital as well. Translation of international guidelines into simple local languages. If you go to the WHO site and CDC, they are formally in English, okay? But nowadays, at a country level, every country, whatever is their regional language, official languages, you can get the translation of these guidelines. Customer surveillance system focused on individuals' healthcare settings requirements. So every ICUs will have a special, a different kind of a surveillance system. Okay, surgical ICUs will have a different surveillance system. Cardiac ICUs will have a different surveillance system. Post-operative ward will have a different kind of a surveillance strategy. Okay, so it is completely focused on healthcare specialties requirements. You can change your surveillance system. Okay. Surveillance information software for antibiotic resistance monitoring and antimicrobial use. This guideline is especially for the microbiologist, lab technicians, and doctors. They can use this software to keep an eye for antibiotic resistance that's happening in their hospitals. Low cost point of care test can be done as a part of laboratory services. So it is not that sophisticated instruments, okay, and it is not that expensive as well. Encourages healthy competition and active participation through feedback or feed forward cycle, which means when the staffs are competitive with each other, especially you can create this competition between departments. Okay, who will get the best department award this month? Is it the cardiac department, neuro department? So there will be a healthy competition in these areas. Okay, so how can you give this healthy competition? Keep giving feedback at department level. This ward did a good job. That ward is not doing a good job. At a ward level, when you criticize them, next time they will be more competitive to do better. Okay, so this kind of encouragement you have to do. Staffing and planning and distributing workload according to the available manpower and resources. So this is critical. This is very critical, but implementing it is more tricky. Okay, if you don't have enough staff, you can't do staffing, planning, and distributing workload. But how much of a staff you have at your disposal, with them, if it is a 100-bedded hospital and you just have 20 to 30 nurses, okay, with the available resources, the best you can do, you have to work with it. Okay, best possible outcome you have to create and work with it. Provide basic infection prevention control infrastructure through hand hygiene products, masks, gloves, gowns, and promote safe practices. This is the basic foundation of infection prevention. Hand hygiene, personal protective equipment, and safe practices. This is the foundation. If the foundation is clear, they can do a much better job later.